Good morning. On today's topic, we are going to discuss about infantile swallow. Swallowing, it is a basic function that begins right from the birth. As the child grows, this pattern also changes. So during the infancy, due to the absence of teeth and also due to the milk feeding habits, there is a special pattern known as infantile swallow pattern. In the infantile swallow, the tongue it is placed between the gum pads, and here the swallow it is guided by the lips and the tongue. Here the mandible it is positioned by the muscles of facial expression. Infants suckling and swallowing it proceeds together. In the suckle swallow, there is caving in of cheeks, elongated tongue, anterior mandibular thrust and also extended head. Now with the change in the food habits from the liquid to semi-solid state, there will be a change in the swallowing pattern to adult or mature swallow. And if this doesn't take place, it can result in tongue thrusting and may develop into a retained infantile swallow. So now talking about the adult or the mature swallow, here the teeth are placed together and also the mandible it is stabilized by the muscles of mastication. Here the tongue it is positioned against the palate above and behind the incisors. But in the retained infantile swallow, the jaws will be apart while swallowing and there will be nodding of the head, anterior mandibular thrust, caving in of the cheeks. Here the tongue it is placed between the teeth and also the muscles of the facial expressions will be involved. Furthermore, it can or it may lead to malocclusions. Thank you.